So our last guideline update actually came out in 2010. So it's been 14 years since the last one. And epilepsy care has changed a great deal in the last decade and almost a half. Um, the guidelines from 2010 really focused a lot on epilepsy surgery and on inpatient epilepsy care related to the epilepsy monitoring unit, as well as some guidelines around diagnostic testing. And all of those are really important areas that we continue to address and have evolved further in the new guidelines. We have more to say about each of those. But the biggest difference, I think, is that the new guidelines really expand the boundaries of what we are addressing as important elements of epilepsy care. And the biggest change is going to be that there's a lot more about outpatient care. And this really spans a fairly broad set of issues. We have, for instance, recognized the importance of care coordination, that many of our patients have to go to multiple specialists, the importance of medication access and medication management, the importance of managing special populations, patients like women contemplating childbearing when they have epilepsy, or individuals with developmental disabilities, or individuals with psychogenic non-epileptic events. All of these are now subjects that we talk about in the guidelines. And the other thing that came through in this is that really need to recognize needs that the patients have identified. So for instance, patient communication is a topic that came up across areas in the guideline development. Patient education was another one that was quite important. And then psychosocial services, really taking care of the whole patient, mental health care in particular, was called out in the guidelines as well. The new guidelines are really there to try to improve the quality of life for patients across multiple domains. And so starting with control of seizures, obviously making sure patients are taking the best medication, the medicines that are most likely to work for them. Often that's going to be through epilepsy centers that there's the expertise in using those medications. It involves using non-medical therapies like epilepsy surgery or devices. Again, the expertise for using that type of tool is going to be in epilepsy centers. And then it really involves taking care, as I mentioned, of the whole patient, of looking across the different aspects, the mood, the medical comorbidities, the other needs that patients have. And epilepsy centers are really thinking about patients broadly, not just controlling the seizures, not just prescribing an anti-seizure medication, but really thinking about what are the other needs, the likely problems this patient is going to encounter, and what can we as the center do to minimize that. Current guidelines are really there to push epilepsy centers a little bit to try to think broadly about all of these needs. They're there to help centers develop resources. A lot of that involves moving the payer community to recognize that these are also important needs that these patients have, and they need to be supported on the revenue side. And together, by pushing payers, pushing centers, we're hoping to advance the care for patients with epilepsy. And I think one of the big changes in how we developed the guidelines really was that not only did we use a much broader group of stakeholders, other clinician specialists, surgeons, social workers, psychologists, in coming up with the guidelines, but most importantly, we included patient voices. A significant proportion of the guideline development group were patients themselves or patient caregivers. And that importance of shared decision-making really came through loud and clear across all the guidelines. I think the two things that I would say that patients were loudest on was communication, the importance of really knowing what's going on and having feedback about their care and evaluation, and then shared decision-making, having input, knowing what all the options are, not just the one that maybe that center does or specializes in, or what that medicine that that doctor knows best, but to know what all of the different options are. So I think the guidelines were really conceived with this idea of giving patients the data they need to really participate fully in their care, to give them the loudest voice, to make sure that their communications are sound. All of that is part of good patient care. And I think we're baked into our guidelines right from the very beginning.